Welcome to this podcast on entomodermoscopy. With the term entomodermoscopy, we indicate dermoscopy of skin infections and infestation. The term, in fact, derives from the union of dermoscopy and entomology and underlines the role of dermoscopy as a link between dermatology and entomology. Here we will see together the dermoscopic features of some very common skin infections and infestation. We will start with infestation in this entomodermoscopy part 1, then we will finish with the second podcast on skin infections. The first description of the applicability of dermoscopy in the diagnosis of scabies was made by Dr. Argenziano in 1997. The dermoscopic pattern resembles a jet with contrail. In microscopic studies, it was shown that the brown triangle corresponds to the anterior portion of the mite, and the posterior part of the mite is invisible as the abdomen and posterior pair of legs appear translucent. The mite burrow correspond to the contrails and can contain feces that can be seen as small brown dots. Later studies confirmed that these findings are very useful in the diagnosis of scabies and proved the usefulness of dermoscopy in the diagnosis. A further study compared dermoscopic diagnosis and of scabies with traditional microscopic ex vivo identification and revealed not only that sensitivity is comparable, 91 versus 90% each, but that also the therapeutic decision-making of unexperienced clinicians was improved by dermoscopy. Further, dermoscopy was also less time-consuming than microscopic examination. Here, again, another case of a common skin infestation. This is a patient coming for increasing itching in the pubic area. And we already can see by the clinical image some brownish to grayish structures that are very suspicious. And by dermoscopy, we can see exactly the pubic lice, so the so-called phtirius pubis. And by dermoscopy, we can clearly appreciate the typical broad body of the lice and the large legs, which have thick claws for grasping hairs. We can also appreciate the presence of nits fixed to the hair shaft. Another very common infestation is given by tick bites. Dermoscopy was reported to highlight the presence of the tick in the skin by enabling the visualization of anterior legs protruding from the surface of the skin and the brown to gray translucent body of the tick. Following the removal of the tick, we can also appreciate by dermoscopy if the treatment was successful or not. The detection of brown to black to gray areas of pigmentation by dermoscopy indicates an incomplete removal, like in the case here on the left. Here we have some remnants of the anterior part of the tick that are recognizable in the skin. Tungiasis is mainly endemic in the tropical regions of South and Central America, Africa, Asia, and Caribbean islands, and because of its low incidence outside the endemic areas, its recognition and its diagnosis may be delayed. Dermoscopy of the disease typically reveals a white to light brown to flesh-colored nodule with a central targetoid brownish ring surrounding a central pore. The white to light brown, opening corresponds to the posterior part of the flea's exoskeleton. Sometimes gray to blue blotches can be seen, and they may represent the intestinal part of the flea. This is a case of a patient coming from an endemic area, and with dermoscopy we can see another feature, which is the presence of these whitish structures in chain-like distribution, so these ovoidal whitish structures corresponding to the direct identification of the eggs of the tunga. Another exotic infestation that is most commonly seen in tropical regions is caused by certain fly species present in South America and Africa. Humans can be infested by the larvae and present with one or more large, itchy subcutaneous nodules with a central pore. Dermoscopically, not only the larva can be seen as a central yellowish oval structures, but also the movements of the larva in the skin can be observed easily, which can aid in the diagnosis of furuncular miniasis, like in the case here. Thank you very much.